Hi, my name is Brian Lau. I'm with the Sports Medicine Acupuncture Certification Program. I also do a lot of work with something called Jingjin movement training, where I look at sinew channel movement patterns. So we're going to be talking about that a little bit today. And I want to, first of all, start by thanking the American Acupuncture Council for having me. So it's always nice to come and talk about this type of stuff. This particular webinar will feature some exercises. You could use these exercises for patient exercises, and I'll give you some indications for that. But they're also great exercises to use for your own wellness program. So let's go ahead and jump right into it. We'll go ahead and look at the slides. So just to start off with, let's kind of look at the channel orientation and look at sort of a planar approach to the channels. So, you have several channels that basically line up along the sagittal plane. If you had a sagittal plane going in the midline, the mid-sagittal plane, it would go right in through the renmai and out through the dumai. But if I were to move that channel over, I would start accessing things like the stomach channel, the spleen channel, the lung channel, the large intestine channel, kind of the kidney channel too on the abdomen. But most of the kidney channel would be on the back part of the body with the urinary bladder channel, the heart channel, and the small intestine channel. Those more line up on that sagittal plane in the back. So those channels primarily do flexion and extension type movements. A lot of Qigong patterns feature those channels quite a bit. A lot of them kind of ebb and flow between those flexion and extension of the torso, stabilization of the spine, kind of this growing and expanding, and a whole bunch of movement patterns associated with that. I've done some webinars on those movement patterns. Maybe in the future we'll do a few more. But today I want to bring the attention to the frontal plane alignment. So that plane would go through the body on the side along the Sanjiao channel and the gallbladder channel, and it would exit through the medial part of the thigh along the liver channel, or the middle of the arm along the pericardium channel. Those sinews of the channel, so to speak, they attach in a way that does primarily side bending type motions and rotational type motions. So let's look at a little bit of anatomy with that, and that'll set us up for doing a few of the exercises. So here's a kind of a representation of the gallbladder sinew channel. You can see that these line up mostly along the lateral aspect of the body. Some of the structures, like the IT band, go pretty much straight up and down. But other ones you might notice have a little bit more of a diagonal position, maybe down and out, like in the obliques, or you have the lats, which primarily just kind of go straight up and down. There's a little bit of an angle to them. So these are aligned in such a way that they can do side bending, abduction, abduction type movements. So movements in the frontal plane. This is the representation of the liver sinew channel. Classically, it ends at the groin, but I take it up into this continuous myofascial plane through the iliacus, the quadratus lumborum, and psoas. So these structures, again, they kind of line up along that frontal plane. A frontal plane would exit out through this area on the thigh, and they do things like adduction, adduction. But a lot of the sinews, like I've kind of alluded to already, do kind of spiral around the body. So even though they can do side bending type motions, like side bending of the trunk, they can also do rotation, like the external obliques, rotating the rib cage in a contralateral direction away, rotating it to the opposite side, or the serratus anterior. The pericardium sinew channel involves or includes the serratus anterior muscle, but then it also kind of wraps around following that myofascial link into the rhomboids. It creates a sort of sling that helps rotate the shoulder girdle. We're going to look at a lot of shoulder girdle rotation aspects today. So that just gives you a little summary of the anatomy. So then what's the benefits? What's the goal? What do we want to accomplish by doing movements in this frontal plane or the transverse plane, side bending type motions or rotational type motions? First one is it's going to build qi in the Shaoyang and Jueyin channels. We're going to look at a quick video in just a moment that'll show some examples of that. It's going to balance the position of the shoulder girdle, rib cage, and pelvis. So we want to kind of work with aligning those three major centers of the body: the shoulder girdle, rib cage, particularly the lower rib cage, because there's a lot of movement potential in the lower rib cage, and then the pelvic girdle If we move those, really what we're doing, because there's a lot of sinews that connect those to the spine, so we're basically mobilizing the spine, things like the sacroiliac joint and the pelvis. And then if we're moving those structures, we're also mobilizing and massaging the internal organs. For working with these particular channels, it's the case that those are primarily going to be mobilizing things like the liver, the pericardium, the sanjiao, and the gallbladder, but particularly the liver and the pericardium will be something that we look at. So let's start with the first goal, basically, the first benefit, to build qi in the Xiaoyang and the Jui-Yin channels. That'd be gallbladder, sanjiao, liver, and pericardium channel. And let's go to a short video and just look at these types of motions to give a kind of an example of what these movements look like. All right, let's look at the second goal, which is to balance the position of the shoulder girdle, rib cage, and pelvis. I'm going to use a model, this tensegrity model. Some of you might have seen this type of model before. It's a really good representation of the human body and the form of the human body. I think in the past, people might have just looked at like layers of things like a bricks on top of bricks to like a wall or something to describe the alignment of the body. You know, one bone stacked on the next bone, which is stacked on the next bone. Very much like a brick is stacked on the brick. Those are really more of a compression structure where the force goes through the wall, and great for a building, great for those types of things. It's not a great representation for the body. For instance, if you were to move that wall into an angle, the thing would kind of come crumbling down. It needs to kind of have that stacked alignment. Our body's more like this tensegrity structure where our bones, like these wooden dowels, are floating in the sea of continuous tension, which is formed by our myofascia. And it's the myofascia that gives the form to the structure. You know, so if I were to misalign it or shorten one of these wires, one of these elastic bands, it kind of distorts the whole structure. Maybe the person comes in complaining of pain somewhere away from this problem. And as we release this or change the tone here, that kind of helps realign the whole structure. So our body's much more like this. So if you were to bring your attention to the bands along the lateral aspect, that would be a good representation of the sinew channels of the gallbladder and sanjiao channel, for instance. And the tone of that has kind of a nice ebb and flow between one side and the next. You kind of saw this with the movements that we were doing, where one side shortens, the other side shortens. There's kind of a nice ebb and flow. If I were to bring the Jui-Yin channels into it, there can be nice rotation between these structures too. But there's a communication that happens between the in this case, the wooden dowel on top and the wooden dowel on the bottom, between, say, the shoulder girdle and the pelvis. They're going to communicate with each other through this continuous tension network. So if we can work on getting movement in the shoulder girdle, that's going to help pull on the rib cage and move the rib cage, and it's going to pull on the pelvis and move the pelvis, and vice versa. If I move the pelvis, it's going to communicate through this continuous tension network via the myofascia. So we're going to be educating and aligning the structures through these Xiaoyang and Jui-Yin channels. So it's a nice model. We're going to look at some exercises in just a little bit. You can kind of keep sort of a visual of this nice tensegrity model because it's a really good model for understanding movement in the body. So let's go back to the presentation. So we'll go to the third benefit and goal, which is to mobilize the spine, the sacroiliac joint, and the pelvis. So you can look at this, this kind of rib cage structure and the spine structure and note that there's a lot of kind of coupled movement of rotation and side bending. But what I really want to consider is that the structures, the myofascial sinews that attach the shoulder girdle to the spine, thoracic spine in particular, if those are moving and mobilizing, that's going to pull on the spine. That's going to sort of contribute to a nice movement in the spine. It's going to help that rotation and side bending of the spine. Same thing with those structures like the serratus anterior that attach the shoulder girdle to the rib cage. That's going to pull on the rib cage. That's going to help mobilize that thoracolumbar junction region. And then there's sinews that attach the pelvis to the spine, quadratus lumborum, the psoas, the obliques. These are all structures that would be part of the network of channels we're looking at. Those are going to help communicate movement from the pelvis into the spine. It's very hard to sort of picture movement of every spinal level when you're doing a qigong or a therapeutic exercise. So I kind of like to put my focus on the shoulder girdle, rib cage, and pelvis and allow the sinews to pull on the spine and mobilize the spine through that network. The image on the right shows the innominate bone movements and things like walking, but there's a lot of qigong patterns that involve that sort of spiraling, contralateral, sort of torsional type movement through the pelvis to help normalize that movement in the innominate bones and create good, healthy movement in the sacroiliac joint. So the exercises we'll look at in just a moment will really feature a lot of these types of movements. So the final benefit then and the final goal will be to mobilize and massage the internal organs. So the image on the left is showing the pericardium. You can take note that the pericardium has attachments onto the spine. It has attachments on the rib cage. It has attachments on the sternum. So if I were to think about this tensegrity structure and that pericardium was sitting sort of in the middle of this, attached to all of these structures, as they're moving and stretching and pulling and turning, that's going to help pull on the pericardium. So it's going to create a mobilization and a kind of a shearing force into the pericardium. Same thing with the liver. In the image on the right, it has a movement in the frontal plane. So as I'm going into this side bending type motion and expanding and stretching one side and shortening one side, that's going to take the liver into a nice range of motion. It also has a transverse plane motion. So there's a rotational type forces are going to pull on that liver and kind of help take it into a nice range of motion. So that's what I want to look at with these groups of exercises. I'm going to take you through a couple exercises and you can follow along with them. And like I said, these can be your own exercises you do for your own wellness program, but they do make really nice patient exercises. So let me go and get set up for that. We're going to be in a slight different position. I'm going to be standing and I'll walk you through 2 exercises that can be used for patients or for yourself. So we're going to look at a therapeutic exercise for the Sanjiao sinew channel along the lateral aspect of the arm and up into the shoulder girdle, and its paired pericardium channel on the medial aspect of the arm into the rib cage. From there, it actually wraps around the rib cage. Both of these channels influence rotation and side bending type motions. So when you're doing those rotation and side bendings, that helps mobilize the thoracic spine. The sinews pull on the thoracic spine, and that helps massage the internal contents of the thoracic cavity, particularly the pericardium organ. So let's look at this exercise, and I'm going to do it mirror to you. So what I call out will be opposite, so you can follow along. So the right hand will be on top, fingers facing in the opposite directions. Turn to the left, open. Turn to the right, and close. Turn to the left, open, expand. Turn to the right, close, compress. Turn to the left, open. Turn to the right, close.
Turn to the left open. One hand is higher than the other hand. That helps move the shoulder girdle on the rib cage. Turn. They can become level and they change. So it's mobilizing the shoulder girdle on the rib cage. Turn, open, expand. Turn, close, compress. Turn, open, expand. Turn, close, compress. Turn, open, expand, one hand higher than the other. They become level and they change. Turn, expand. Turn, compress. Change directions. So left hand on top, fingers facing to the opposite directions. Turn right, expand. Turn left, compress. Turn right, expand. Hands move away. Turn left, compress. The hands start coming together. Turn right, expand. Turn left, compress. Turn right, expand. Turn left, compress. Turn right, expand. One hand's higher than the other. Turn, they change. Comes around, turn right. One hand higher than the other. Turn, they change. Turn, expand. Turn, compress. So we're massaging the rib cage, thoracic spine, pericardium organ, Sanjiao organ, at least in the upper jiao. And we're creating mobility and fluid motion throughout that region. Open, turn, expand. Open up the stance. We can do another exercise. This one starts to involve much more of the whole body, so including the liver channel and the gallbladder channel. So reach up. It still has that opposite opposing motions. So it's working the Shaoyang and the Zhuiyin channels in rotation and side bending. Hands separate, one arm pulls back, the other hand pushes out. Hands come together, turn. Turn, one hand pulls back, the other one pushes out. Balance, reach, expand. Turn. Turn. Reach across. Turn, one arm pulls back, the other one pushes out. Turn. Change directions, reach across, pull the arm back, push the arm out, and change. Pull the arm out, push the arm out, change. Pull the arm back, push the arm out, turn.
All right, hope you enjoyed the exercises and you found those useful. Again, I want to thank the American Acupuncture Council for having me on. It's always a pleasure to be here and work with the American Acupuncture Council and with everybody who's taking part in the webinar. So I'll see you guys next time.